Well, hello everyone. Thank you all for joining me today. My name is Eric Eveland, benefits consultant and founder of the Eveland Group. We focus on helping simplify the complexities of health insurance and build benefit strategies that truly support employees. Health insurance can be confusing, filled with unfamiliar terms, varying plan structures, and evolving coverage rules. My goal today is to help you cut through that confusion. We'll explore the essentials of how health plans work, highlight key differences that impact cost and care, and share practical insights that can help you make better decisions. Whether you're experienced with health insurance or simply someone looking to better understand your coverage, this session is designed to give you clarity, confidence, and actionable knowledge. Through this presentation, if you have any questions, feel free to post them anonymously using the Q&A button on the bottom of your screen. And then at the end of the presentation, we'll address as many as we can. Okay, let's talk about what we'll be covering today. So we're going to break down the key components of a health plan, from deductibles and coinsurance to out-of-pocket maximums. We'll explore the three different types of health plans available: high deductible health plans, hybrid models, and copay-based plans. And we're going to explain how each impacts your healthcare experience and the costs. We'll also look at important distinctions like in-network versus out-of-network care, generic versus brand name prescriptions, and then when to choose telemedicine, urgent care, or the emergency room. Plus, we'll cover valuable tools like mail order prescriptions, tax advantage accounts, and preventative care benefits that come to you at no cost. And then finally, I'll share some practical tips on how to challenge denied claims so you can feel empowered to advocate for the care that you deserve. Let's get started on making health insurance clearer, smarter, and more accessible. So, for our first topic, we're going to break down the three components of a health insurance plan: the deductible, coinsurance, and out-of-pocket maximums. These terms are often confusing, but once you see how they fit together, it makes navigating your benefits so much easier. So an easy way to think about these terms actually is in phases, and you need to work through each phase to get to the next. Our first phase is the deductible. This is the amount you pay out of pocket before your insurance company starts sharing in the costs for your medical expenses. Think of it like an entry fee to your benefits. So for example, if you have a $2,000 deductible, you'll generally pay 100% of the first $2,000 of medical expenses, with the exception of preventative care. But once you've met that deductible, the health insurance kicks in and you move into the coinsurance phase. So you've met your deductible, and now the health insurance plan is sharing in the costs for your medical expenses, and you're responsible for the copays and coinsurances. Well, what's the difference between these two terms? A copay is a fixed dollar amount you pay for certain services, like $30 for a primary care visit or $10 for a prescription refill. Copays, they're simple and predictable. As for coinsurance, instead of a flat, you pay a percentage of the cost for medical expenses. For example, let's say you've already met your deductible and you have a 20% coinsurance. If you get a $1,000 procedure, you pay $200 or 20% of that cost. And then the insurance will cover the other $800. And finally, the out-of-pocket maximum is the final phase. This is your financial safety net. It's the absolute most you would pay in a year for covered care. It includes deductibles, copays, and coinsurance. Once you hit this number, your insurance company pays 100% of covered services for the remainder of the plan year. So for example, if you're if you have an out-of-pocket maximum of $7,500, once you've paid that much in, again, deductibles, copays, and coinsurance, you won't pay another dollar for in-network covered care until your plan resets at renewal. And that's the summary of the components of a health plan. If you can simply remember these four terms, deductible, copay, coinsurance, and out-of-pocket maximum, and how they work, you'll have the foundation to understand any health plan. Let's pivot the topic just a little and take a moment to touch on the differences in deductible and out-of-pocket maximum aggregations and how they work when you have more than one person on a health plan. For simplicity of this presentation, we're going to focus strictly on the deductible. So this is often referred to as an aggregation design. This includes individual aggregation and family aggregation. For individual aggregation, or often referred to as embedded or aggregate, each family member has their own individual deductible within the plan. Once a person meets their individual deductible, they move to the coinsurance phase, even if the rest of the family hasn't met the full family deductible. So for example, meet Tom, Sue, and little Timmy. They have a health plan with an individual aggregation design where the family deductible is $4,000, but the individual deductible is $2,000. Let's assume that Tom's not doing so hot these days and he's racking up some bills. With an individual aggregation deductible, once Tom hits $2,000 in medical expenses, he would have met his individual deductible and he can move to the coinsurance phase. But if Sue or Timmy need care, they would still be required to meet the remainder of the family deductible before they move to the coinsurance phase. Now, of course, if multiple family members incur expenses, the plan tracks both individual and family totals. And then once the family hits $4,000, everyone moves to the coinsurance phase, regardless of the individual progress. In contrast, a family aggregation design requires the entire family to meet the full deductible before any member moves to that coinsurance phase. So if a family member, or if the family deductible is $4,000, that amount must be collectively met before moving to the next phase. There's no individual threshold. Coverage only begins once the family hits the full amount. This distinction between these two is very important when evaluating plan designs, especially for those families that have varying healthcare needs. The individual aggregation can offer earlier access to coverage for individuals on that family plan. Okay, for our next topic, let's talk about the three different health plan designs that you typically see. Now, when we look at different health plan designs, think about it on a spectrum. The left, you have plans with deductibles. Think bronze plans. On the right, you have plans without deductibles. Think platinum plans. And in the middle, you have plans that have characteristics of both. Think silver and gold plans. Each one is designed a little differently, and understanding those differences can help you choose the right fit for your needs. Let's start with high deductible health plans on the left. These plans have a lower monthly premium, but a much higher deductible. Preventive care is covered at no cost with these plans, but for most other services, you'll pay full cost until you hit your deductible. The key advantage is that high deductible health plans are HSA eligible. That means you can put money into a health savings account, that HSA, tax-free, and you can use it for medical expenses. And we'll touch more on that in a bit. On the other end of the spectrum, they're your copay plans. These are the most predictable and straightforward plans that are out there. You have a fixed copay or coinsurance for most services like doctor visits, urgent care visits, or prescriptions, right from the start. And there's no deductible to meet. The trade-off, monthly premiums are much higher than the other types of plans. And right there in the middle are the hybrid plans. As I mentioned, they have characteristics of both high deductible and copay plans. Typically, you'll have everyday services like doctor visits, prescription refills that won't be subject to the deductible, and you simply pay a copay for them. For the major services like hospital stays or surgeries, they're likely subject to a deductible before the plan shares in any kind of medical expense. Premiums with these plans are usually moderate. They're not as low as a high deductible plan, but not as high as a copay plan either. And that's really the difference between these three different types of plans. Remember that each plan has its strengths, and it's all about which one matches your healthcare needs and budget. Now let's talk about one of the biggest areas of confusion in health insurance, what it means when a provider is either in-network versus out-of-network. Understanding this can save you a lot of stress and probably a lot of money. When a doctor or hospital or clinic is in-network, it just simply means your insurance company has a contract with them. The provider has agreed to give care at discounted, pre-negotiated rates. Alternatively, out-of-network means there is no contract. That provider can charge you whatever they want. With out-of-network providers, also keep in mind that your insurance company may cover less or sometimes nothing at all, depending on your plan. The one thing to note here is if your plan does have out-of-network coverages, it's likely that it has its own separate deductible and out-of-pocket maximum limits compared to the in-network benefits. And finally, staying in network can make the difference between paying a small copay and getting hit with a large bill. Now, one question that we often get is, well, what if I'm traveling around the United States and I need to go to a hospital? It's not likely I'm going to find an in-network hospital close by. And that's probably true, right? The short answer is that health insurance plans are required by law to cover emergency services in the ER as if they were in network, even if you go to a hospital that doesn't normally accept your insurance. But keep in mind that these need to be true emergencies when you do visit these ERs for it to count. So how can you ensure that your providers are in network? Well, the easiest route is to use your insurance company's website or their mobile app. They all have a provider search engine available that you can search up your doctors. You can also just call your provider's office directly and ask them, hey, are you in network with ABC Network and CDE plan name, right? So just simply ask. But as a piece of advice, always double check that your specialists and your lab and imaging centers are in network. Just because your primary care doctor refers you to them, it does not necessarily mean that they accept your current insurance plan. Moving along. Next, we're going to walk through how prescription drug coverages work in most health plans. We'll look at the four main categories: generics, preferred brands, non-preferred brands, and specialty drugs. Knowing the difference can save you a lot of money at the pharmacy. First, let's start with the generic drugs. Generics are chemically the same as their brand name counterparts. They have the same active ingredients, the same strength, and work the same way in your body. The true difference is cost. In most plans, generics fall into a lower cost tier, often referred to as a tier 1 drug. That means that you'll usually pay the smallest copay or coinsurance for them. Next are the preferred brand drugs. These are medications that your insurance company has negotiated discounts on. They're usually placed right in the middle tier, so maybe a tier 2 drug. So your copay or coinsurance naturally is going to be higher than a generic, but lower than a non-preferred brand, which leads us to the other non-preferred brand drugs. These are brand name drugs that don't have negotiated discounts with your carrier, and they're one of the more expensive options available. They too fall into a middle tier, typically maybe a tier 3 drug. You'll often pay a much higher copay or percentage of the cost than you would for a preferred drug. Just so you're aware, insurance companies, they list them as non-preferred because there are usually alternatives, whether it's generics or preferred brands, that are just as effective, but probably less expensive. And finally are your specialty drugs, which are typically there to treat complex, rare, or chronic health conditions. These drugs themselves may require special handling, and patients who use them may need to work closely with doctors, pharmacists, and other healthcare providers who can monitor their progress. The specialty drugs, they can be classified in your health plan either as a tiered drug, like we just talked about, or as an actual medical benefit, like diabetic supplies or chemotherapy, are a couple of examples. And that's it. Now that you better understand the different drug coverages, one tip that we like to share is to always ask your doctor if there's a lower cost prescription alternative that works just as well as the one they're prescribing. It could save you a considerable amount of money. Okay, let's switch gears and talk about one of the biggest challenges in healthcare. Where do you go when you need care? Should you call your doctor? Go to telemedicine, use urgent care, or head straight to the ER? Today, we're going to walk through these options so you can pick the right source for your care when you actually need it. So let's start with primary care. This is your main doctor or nurse practitioner. Primary care is best for ongoing care and prevention. Things like checkups, screenings, managing chronic conditions like diabetes, or talking through non-urgent concerns, although some offices can handle urgent care needs. They know your medical history, they coordinate care with specialists, and they help you stay healthy long term. The limitation, they usually aren't available on nights or weekends, so they're typically not ideal for those urgent issues. Next, telemedicine. This is care delivered by phone, virtually, or in an app. It's best for minor routine issues like colds, allergies, fevers, skin rashes, or prescribing medications. It can include dermatology, and it does have a mental health component, mental health service component. It's quick, can be done in the comfort of your own home, and it's accessible 24/7. It's also usually the lowest cost option. With some of your health plans, they even offer telemedicine at no charge to you. Now, urgent care. Urgent care centers are for problems that need attention today, but aren't life-threatening. Examples include minor broken bones, stitches, ear infections, or high fevers. They're open evenings and weekends, and the cost is moderate. It's going to be higher than telemedicine or a visit to your doctor's office, but it is going to be lower than going to an emergency room. Which leads me finally to the emergency room. So the ER is for serious life-threatening issues only. Think chest pain, difficulty breathing, stroke symptoms, severe bleeding, or major trauma. This is the most expensive option and often has the longest wait times, but it's definitely the right place when every minute counts. Okay, so we've covered a lot about the specifics of the actual health plan, how the coverages work, and where to get care. Now it's time that we discuss some of the tools and tips that can help save you money when you do need care. So let's touch on how to save money and make smarter choices when it comes to prescription drugs under your health insurance plan. Most health plans offer the option to get your prescriptions by mail. So instead of making a trip to the pharmacy every month, your medications are delivered right to your door. Also, most health plans offer a 90-day supply through mail order at a lower cost than if you were getting three 30-day fills at a retail pharmacy. So always something to think about. Let's also talk about the pharmacies themselves. Most health insurance companies offer a mobile app or through their website that lets you compare drug prices across different pharmacies. So the next time you fill up your prescription, check which nearby pharmacy offers the best price. Prices can vary significantly even within a few blocks. Also, don't assume that prescriptions through your insurance is always the cheapest option. You should check out online discount pharmacies like GoodRx or Cost Plus Drugs. They can offer lower prices than your insurance copay, especially for the generic medications. So it's worth taking a look. But the one thing to keep in mind is that you generally can't use your health insurance with discount pharmacies. Next, let's jump into the different tax-advantaged accounts that you can pair with your health plans. So there's three primary types of accounts. You've got your health savings accounts, or HSAs, flexible spending accounts, or your FSAs, and your health reimbursement arrangements, HRAs. Your HSA, or your health savings account, is available only if you're enrolled in a qualified high deductible health plan. Both you and your employer can contribute pre-tax dollars into the HSA, and those funds can be used tax-free for qualified expenses. That includes covering deductibles, copays, dental or vision expenses, and some over-the-counter items. What's nice is that the HSA balance is owned by you. Any unused money rolls over from year to year. The balance follows you even if you leave your employer, and you can invest those dollars for long-term growth. Next, the FSA, or the flexible spending account. This account is funded by you through your paycheck with pre-tax dollars. Now, similar to the HSA, these funds can be used tax-free for qualified expenses like deductibles, copays, dental or vision expenses, and some over-the-counter items. In addition to the FSA, you may have access to what's called a dependent care flexible spending account, which can cover things like daycare, after school programs, summer day camps, or care for a dependent adult who can't care for themselves. One of the perks of the FSA or even a dependent care FSA is that even though you contribute to it gradually through equal payroll deductions throughout the year, your entire annual election amount is available to you on day one of the plan year. But the catch is that it does have the use it or lose it rule. Most FSAs require you to spend the money by the end of the plan year. But understand that there are some plans that do allow for a small carryover. And finally, the HRA, or the health reimbursement arrangement. Now, unlike FSAs and HSAs, the HRA is funded solely by your employer with pre-tax dollars. You don't make any contributions. Now, your employers, they set the rules on what the funds can be used for, but they can usually be used for deductibles, copays, prescriptions, and other qualified expenses. The HRA also follows the use it or lose it rule, where it requires you to spend the money down by the end of the plan year, although, again, some companies do allow for a small carryover. To continue on the subject of being a better consumer, we need to cover preventive care. It's one of the smartest investments you can make in your health. Most health plans cover preventive visits and medications at no cost to you. This means that you can get them without paying a copay or meeting your deductible. Preventive care covers a wide range of services, which typically include routine checkups, vaccinations, immunizations, screenings, and some preventative medications. Why is this important? Well, because they help catch health issues early when they're easier and less expensive to treat. Regular screenings, vaccines, and medications can prevent serious illness, reduce long-term costs, and it'll improve your overall quality of life. And for our last topic, one of the most frustrating things in health insurance is getting a letter that says, your claim has been denied, right? But a denial doesn't always mean that you're stuck with the bill. So let's walk through what to do if this happens and how you can protect yourself. The first step is simple. Do not panic, right? Most denials are fixable. Carefully read the explanation of benefits or the denial letter that you'll receive, and it should tell you why the claim wasn't covered. A lot of common reasons include the provider billed the wrong code, the service wasn't pre-authorized, or the provider was out of network, or the plan just says that the service wasn't medically necessary. But knowing the exact reason is going to be key to fixing it. Step 2, call your doctor's office or the hospital billing department. Many denials happen because of a simple coding error, missing paperwork, or the provider sending the bill to the wrong place. Just ask them, hey, can you review this and resubmit the claim? You would be surprised how often that resolves it quickly without you having to fight with the insurance companies yourself. If the provider can't fix it, your next call is going to be to your insurance company. You just simply have to ask them, why exactly was it denied? What documentation do they need? Is there a way to reprocess or reconsider the claim? Be sure to take notes, the date, the time, the name of the representative you talked to, etc. Keep a paper trail. That documentation helps if you do need to file an appeal. Which leads me to the final step. If the denial stands, you do have the right to an appeal, and every plan has an appeal process, and they're required by law to give you instructions on how to do it. Often in this stage, your doctor's office can help, so you just simply got to give them a call and ask. You start off by submitting your appeal in writing, and in it, you'll include supporting documents like the doctor's notes, medical records, or letters of medical necessity. Be specific about why you believe the claim shouldn't be covered. Again, this is going to be where the doctor's office will come into play. If that internal appeal is denied, you may have the right to an external review by an independent third party. Many people actually win appeals at this stage, especially for services that are medically necessary. And that's a wrap. Today, we covered the essentials, from how your health plan works to choosing the right care setting, how to be a better consumer using tax-advantaged accounts, and how to challenge denied claims. The key takeaway, know your plan, use your tools, and compare your options. Being informed helps you save money, get better care, and avoid surprises. Now, I know a number of you had some questions for me, so I'm going to do my best to get through these. So don't mind me. So here's a couple questions. As an employee, do I get to choose my aggregation design, either family aggregation or individual aggregation? So the answer to that question is no. All plans are going to be pre-designed with either an individual aggregation or family aggregation. And when you are looking at the summary of benefits and coverage, you will see a line item in there that will define what that aggregation design is. I've got another one. If I have questions on the drugs I take and where they fall and the type they are, should I talk to the insurance company or my doctor? So that's a good question. So when it comes to finding out what tier drug your medications fall into, all insurance carriers do have what's called a formulary. The formulary is a long list of all the drugs that are good for them, that are covered by them, and in that list is going to define what tier drug that they're going to fall in. So again, you could talk to your insurance company. I don't believe your doctor is probably going to be able to help out with that, but ultimately it would be an insurance company question. And you can usually call the concierge hotline at your insurance company, and that'll oftentimes help. Here's another. So if I use something like GoodRx for my prescriptions, will that money I'm spending not go towards my deductible or copay or coinsurance? Okay, so that's a really great question. So what they're asking is if they use GoodRx or Cost Plus Drugs to get their coverage, or to get their medications, will it count towards their health plan? The answer is no. So if you spend $100 for a drug through GoodRx, it typically is not going to count towards your deductible or your out-of-pocket maximum because you're not using your health insurance plan to cover that. If I want to use telemedicine, do I go to my insurance carrier for that or the doctor I want to see for that? Yeah, that's an excellent one. Okay, so with telemedicine, you can actually access telemedicine in a couple different fashions. Number one is that a lot of the primary care physicians that are out there will do virtual visits with you, right? And that would be covered similar to telemedicine. Alternatively, though, I know that a lot of the health insurance carriers actually have their own internal service that they use for their telemedicine. So for example, if you're in the upstate New York region, we have Excellus. Excellus uses a company called MD Live, or if you use Univera, also they use MD Live, and that's the application that you can access for telemedicine visits. Good question. Can I use my HSA or FSA for my family members if they're not on my medical plan? The answer is yes. So remember, when it comes to an HSA or an FSA, those are your dollars. So you do have a little bit of flexibility on what is considered a qualified expense. And a qualified expense for a dependent also counts. So if you want to use your HSA or FSA dollars for your children or your spouse, you are able to do that. And I've got one last one here. Can I enroll in my employer's health plan at any time? That's a good question, and we get that one quite often. So the short answer is typically no. The only time that you're able to typically enroll into your employer's health plan is going to be at two times. One is going to be during their renewal, or what we call open enrollment, right? You're all probably familiar with that. And the other time is if you have what's called a qualifying life event. So a qualifying life event is going to include things like a death in the family, a birth of someone, a major change in geographic location, so you move somewhere to different states, etc. Those are what's considered a qualifying life event. When you have that event, losing individual health insurance coverage would also fall into that tier. When you fall into that, they will have what's called a special enrollment period for those folks. Typically, it's something like 60 days that you have the option to enroll into your company's health plan. So that was a really great question. And I believe that's it. I don't see any other questions really coming through the door. I guess I just like to say, thank you all very much for joining today. I hope that the information was super helpful in understanding health plans and how it works. In closing, stay curious, take control of your health benefits. Take care.